And welcome back to Life Unrehearsed. I'm Matt Delvecchio, specializing in home care, elder care planning, and the senior living industry. Thank you for tuning in. A little Glenn Campbell for you and trying a little kindness. And you know who could use a little kindness? It's our older adults. As our population continues to age, the importance of providing quality care and support for our seniors becomes increasingly evident. And whether it's ensuring their physical health, mental well-being, or simply offering companionship, there are many aspects to consider. And joining me today is a renowned geriatrician at Mount Sinai and University Health Network in Toronto, Dr. Samir Sinha. Dr. Sinha, welcome to Life Unrehearsed.
Thanks for having me, Matt.
Well, thank you so much for joining me here. Our population's aging, older adults is certainly an area that needs a lot of focus. And, the boomers are setting the way here. But I'd love to hear a little bit more about you, Dr. Sinha, and your role as the Director of Geriatrics at Mount Sinai.
Yeah, so as you noted, I'm a geriatrician, meaning that I'm a doctor that specializes in the care of older adults. And there's only about 400 of us across the country. And to put that in perspective, there are more older Canadians now than younger Canadians. Yet there's about 10 times as many pediatricians as there are geriatricians. So there are not many of us, but we really specialize in trying to provide the best possible care for older adults, often those with complex health and social situations. And we try and provide support for those who are living in their own homes and trying to keep them there and as independent as possible, but also trying to make their journeys through a hospitalization that much sooner as well. So we're the largest group now in the country, based in Toronto across a number of hospitals, but there are geriatricians in major cities like Montreal and Quebec City and across the country for sure.
Amazing stat that you're bringing up. And we just assume, okay, mom or dad's getting older, we're going to get a geriatrician. It's just not as easy as that. And let's hope that those numbers get up there, not even close to the pediatrician level. And so good on you for the work you're doing and the advocacy work in helping older adults. So I'd like to talk to you, Dr. Sinha, about some of the common misconceptions about caring for older adults that you see in your practice, and how do you address those?
Yeah, so some of the common misconceptions we have are that as we get older, things are just naturally going to get worse. So people's memories are going to get worse, their mobility is going to get worse, their bones are going to get weaker. And yeah, as we get older, I like to say that we encounter more mileage. The more we use our bodies, the more wear and tear we might experience. But things like dementia, things like fractures and osteoporosis, these aren't things that are guarantees that these are things that are going to happen. And I think for a lot of older people, the challenge that we have is they sometimes think, isn't this what's supposed to happen as you age? And I think a lot of us around that just kind of assume that that's what happens. So I think it's important to appreciate that, yes, as you get older, things don't work as quickly or they don't necessarily work as well. But there are a lot of things that if we identify them early, we can often prevent, things from getting a lot worse. And in many cases, we can reverse things and allow people to stay healthier and independent as they get older as well.
Listening to Life Unrehearsed, Matt Delvecchio here, and I'm talking with geriatrician Dr. Sinha about caring for older adults. Dr. Sinha, you're affiliated with Mount Sinai Health and the University Health Network, just an amazing network based in Toronto. And it's interesting because you not only prioritize physical health, we tend to relate aging with physical health, but there is so much more than that, isn't there, for mental and emotional and social needs of older adults, isn't it?
Absolutely, right? Because we often we might think about our health just being kind of those physical aspects, but we also have to think about kind of our mental health, our cognitive health, how we think, and our memory, and also kind of our social well-being as well. Because we know all those sorts of things are interrelated. For example, we know that extreme loneliness is seen as the equivalent of smoking up towards 15 cigarettes a day. So it just reminds you how much that social connection, that mental health and wellness can really impact on people's well-being. And I think what makes it more challenging to care for older adults is sometimes people don't realize that if someone is experiencing depression, for example, or anxiety, that can start to create symptoms that are similar to memory loss and those issues as well. So you have to, when you're working with an older patient, you need to bring that broader lens towards things, because sometimes things can actually combine and work synergistically, if you will, to create bigger problems. And unless you kind of identify all the root causes, you might be missing something as well.
I'm so glad you're bringing up that whole social aspect. You might have heard Dr. Del Maestro earlier on in the show keep talking about keeping the brain engaged, and we saw the effects of the pandemic and the loneliness and isolation. So important to keep that brain engaged, that socialization, and a very, very good point that we have to continue with our older adults, and quite frankly, for the general population at large. All right, Dr. Sinha, we're going to ask you for some advice here. And could you share some tips or strategies for families and particularly caregivers to ensure the well being and the quality of life of their older loved ones?
Yeah, so I think the key is that as we're getting older, it's reminding ourselves that there are things that we need to do to try and stay healthy and well. So we want to make sure that people are staying socially connected and socially active, and sometimes things that can get in the way are poor vision or hearing. So making sure that those are up to speed. That if people are starting to experience falls, for example, like take a look at your medications. Are you on the right medications? Because as we get older, sometimes you need less of certain medications. Sometimes you need to be on new medications. So just making sure that your medications are what I like to say right-sized, because if they're not right-sized, they could sometimes cause problems. We also remind people to stay up to date on their vaccinations, and then making sure that if they do have chronic health conditions or potentially at risk of chronic health conditions like osteoporosis or other problems related to blood pressure and cardiovascular health, that again, you're just kind of making sure that, am I doing all the right things to kind of prevent those issues from happening or getting worse? Because sometimes those can lead to other conditions like memory loss as well. So it's often the idea of taking a look at everything together and really working together with a good primary care provider to say, are there any opportunities that I'm missing out on here to stay healthy and well? And what could this be related to? And what else should I be thinking about as well?
Talking with Dr. Samir Sinha, a geriatrician based out of Toronto at the Mount Sinai Hospital and the University Health Network. I'd love to ask you, Dr. Sinha, about your insights into navigating the various long-term care options available for our older adults, such as home care and assisted living. You might have heard at the beginning of the show, I'm going to be a guest panelist this coming Friday with Seniors Action Quebec, talking about housing. And right across the country, we here in Montreal, we're always talking about the long waiting list for home care and long-term care. But you know what? It's right across the country. You're seeing that firsthand in Ontario. So what are your thoughts about some insights in navigating long-term care?
So as things start to become challenging to stay healthy and independent, it's always important to kind of see, again, what is it that your family members are able to support and do if they're available and able to do so, and making sure that they're aware of supports that are available to help cover their own costs and the time that they're providing. So it's coming up to tax season, and people may not be aware that in Quebec, for example, there are tax credits, that are available to family members and friends who provide unpaid care. If you're a veteran, for example, there are services that are freely available that can be made as well to benefit you. So it's always important to kind of think about, are there things that we're entitled to, like tax credits or grants or other services? Certainly, for example, in Quebec and similar across the country, there usually is a local kind of home care agency or access kind of point. So usually in Quebec, it's through the CLSAs, and you can, contact them and say, hey, look, we might need some more help to stay healthy and independent at home. Are there home care services that I'm eligible for, or that my mom or loved one are eligible for? What is available? And it's really important to, not assume that, okay, this is what I get or I don't get. I would just work with an assessor to kind of let them know what are the challenges, so they might be able to let you know about things you may not even be aware of.
Yeah,
but certainly if staying at home is not continuing to be a viable option, this is where then again trying to understand, the differences between, assisted living and retirement home settings, what they call RPAs in Quebec, but also there are, kind of CHSLDs like the long-term care homes, and understanding kind of when those might be useful places to consider. What's the application process? Trying to get ahead of that and understanding that earlier on, if you think you might need that, it's really helpful because sometimes there can be waits. And so it's good to not leave these things to the last minute or a crisis, but to try and think ahead to understand what is available, what might you need, and what might it cost, so that you can start preparing in advance for that as well.
That's right. Don't wait for crisis mode. Be proactive. And there is going to be advocating, but it's so important. Dr. Sinha, I want to thank you very much for taking a little time here on a Sunday.
Thanks for having me.
All right, this is Dr. Samir Sinha, Director of Geriatrics at Mount Sinai Health and the University Health Network in Toronto.